Hello, my name is Keir Lewis. I work with Respiratory Innovation Wales. A project we've been involved with during acute COVID-19, the second and third waves, was working and joining different institutions, the NHS, Swansea University, Innovate UK, and also a company that specialises in artificial intelligence and lung ultrasounds. What we managed to do is to do a real world service evaluation where we can bring in state of the art technology direct to a clinical ward and where we scanned patients in real time without any radiation to look at changes in their lungs during COVID. But here we store these routine images online, we anonymize them, and the beauty may be that artificial intelligence looks like it can spot and see changes, subtle changes in these scans that can predict outcome in COVID-19. We are creating new patents and new ways of working and new partnerships.
Hi, I'm Rory from Onkolyze, and we develop algorithms that are used in the detection of disease and the simulation of different medical conditions to try and change the treatment strategy. We have offices in the UK and Singapore. For this particular project, we were looking if we could detect abnormalities in lung ultrasound scans consistent with COVID symptoms. We absolutely loved working with RIW, mainly because of how quickly they were able to act and help us complete the project. Whenever you're working with sensitive patient data, it's always very difficult to navigate your way through the process, and they were extremely helpful in terms of getting us quickly to a situation where we knew whether the project would be able to succeed or not. Whenever you're working with clinical data, it's very challenging if you don't have input from an expert clinician. So Sharon and I would both have expertise in building these algorithms, but we always need to collaborate with someone who is a very knowledgeable expert in the domain of the particular scan that we're looking at. So for that disease and that modality. In this case, Dr. Mark was extremely helpful as he could help us interpret the different landscapes that we needed to be able to identify with the algorithm to detect these lung abnormalities.
I'm Sheraton, CTO of Onkolyze. So the way we built this AI model is we gathered open source data initially of COVID positive patients, and then we annotated these data sets so that we are able to find out important landscapes which the AI model has to pick up. And we implemented a distributed AI system which works across videos rather than across images which are input. So we have a higher accuracy and throughput for finding out COVID positive cases here. So far we have done our model building process on COVID positive data set alone, and we are looking to gather more data on COVID negative cases so that we can show our validation accuracy against a real world data set.